So I'm Chrissy. I was the observer for Gentry and Brianna's role play video.
Hi, I'm Sierra, and I was also the other observer.
The two positives that I have on Gentry's nursing process, number one, her tone of voice was really soothing and calm, and it stayed that way throughout her entire interaction with Brianna. Even when the situation escalated and she thought she was going to be leaving in a danger to herself, Gentry never raised her voice. She never, seemed too stern with her. She seemed just to have a very soothing approach to it. The other positive I have for that was while they were on their walk, she redirected her back to her lunch. So the situation had come full circle. She kept her calm, redirected her from leaving to the walk, and then from the walk back to breakfast. The two critiques I have, I think to keep her a little more calm, maybe get her a little more calm, a little more quicker, she could have oriented her to workplace terms that she was, using and familiar with. So instead of switching back and forth from recess to snack time, she could have just said, the students are at lunch, why don't you sit down and have some lunch, or something to that nature, just to, I guess, get her a little calmer, a little quicker. The second critique I have would be just possibly on the walk, the redirection to her surroundings, maybe get her away from talking about the things she's confused about, and just maybe noticing the things that are happening and what she's seeing on the walk. I think that would be a good distraction, and she wouldn't be as concerned about where her students were.
The first positive I had also goes along with Chrissy's. She kept calm and tried to make sure that her patient felt calm even when she was confused. The second one is she only corrected the patient when necessary. So if she had something she was confused about, she just went along with it, but didn't lie to the patient, which is also really important. The first negative is when you first go into a room, you should always check surroundings. So she should have saw that there were keys out, assessed that it was a danger to the patient, and taken those away, removed them completely. And the second one is to create more space between patient and nurse, so that way whenever they're walking together, if she were to happen to grab the keys behind Gentry's back, stab her with it, cut her with it, it could have been a dangerous situation for both of them.